I've been in the business of health and human services, applying data and analytics and technology for over 20 years. And some of the most interesting examples I'm seeing are happening right now. One example is where a state is looking to combat their infant mortality rate. Big issue, right? We all want to save babies, right? And but what's interesting is when you look at the state, they're very low in across the U.S. And the U.S. as a country is not very well positioned. I believe of the 20 wealthiest countries in the world, they're 17th, and we shouldn't be there, period. So what the state has done is really flipped everything on its head and said, we're going to start by understanding and getting the data that we need to combat this issue. But they're going to go even further, and this is what's really exciting. So it's one thing to sort of say, hey, let's pull this data together and understand what are some of the health factors that are affecting these moms. What are some of the interventions that we want to have to apply to help these moms? And what we've done is we've actually taken the data from the state. So we integrated 30 different data sets across public health, mental health, Medicaid, family services, and a bunch of federal data sets. We've pulled that data together, and we were able to identify moms that were at risk. We were able to identify what are called segmentation models. And what a segmentation model is, think about, moms are 23 to 27 that have these behavioral factors, creating these groupings, and then looking at the interventions associated with moms and determining how well those intervention programs are being applied. And if not, working with the provider network, the visiting home providers, to determine what would be the most effective interventions, what they call cocktail of interventions. All of that is being driven by the data. So that's one of the most exciting things. None of this is being done in a vacuum. It's not a bunch of data people in the corner working in a vacuum, in a box. They're working collaboratively in a very multidisciplinary approach to try to solve that problem. And that's absolutely critical. And so the ability to work with infant mortality requires epidemiologists working with your data people, working with your policy people, working with your providers. So bringing that ecosystem together with one goal in mind is absolutely critical, and that's where the real work is. And if you can do that effectively, you will have success.